There is nothing more frightening than having a chest pain that you feel like is to do with your heart, and you're thinking, is this it? Am I going to die? And maybe not, because chest pain can be due to any number of reasons, such as direct trauma to the chest, stress, anxiety, depression, indigestion, chest infection, inflammation of the chest wall, pleurisy, pneumothorax, blood clot to the lungs, as well as angina, which is usually a sign of a heart attack is about to happen. But in some cases, this can also happen in people with no history of chest pain. Angina, or heart-related chest pain, is simply not enough blood supply to the muscles of the heart and can present as left-sided or central chest pain, which can radiate to the neck, to the jaw, left side of the arm, and can also present as numbness down the arm. This can last from 5 to 20 minutes on average, but in some cases might be prolonged, and hopefully you or someone close by would have called the ambulance way before then. Some might get chest pains while sitting down just resting or while eating a meal, which is why it can be confused with indigestion, and also during other activities like gardening, walking, or any other forms of exercise. With the chest pain, you might get sweaty or clammy, or you might feel an impending sense of doom, like the walls closing around you. You might get your heart racing fast, known as palpitations. You might feel faint, dizzy, weak, and feel short of breath. Also note that you can get these symptoms without chest pain and could still be a heart attack. Also, taking your indigestion tablets or ibuprofen would not work for heart-related chest pain, but it might be effective obviously for indigestion or other causes of chest pain such as costochondritis, which is inflammation of the chest wall. In terms of those likely to get heart-related chest pain, they might have risk factors such as being aged over 50, obesity, ethnic minorities such as being Asian, smoking, drinking too much alcohol, if you're a post-menopausal female, if you live a sedentary lifestyle, which means not really exercising, being a couch potato, high blood sugars, cholesterol, blood pressure, thyroid problems, as well as a family history of heart problems. You should think more seriously of could this be a heart attack. I once saw a 35-year-old Caucasian male who, while eating lunch with his meal, has symptoms of what he thought it was indigestion. And he was actually joking about it, but this actually turned out to be a heart attack. I mean, he came down to A&E, we jumped on his chest, we did everything we possibly can, but sadly, he did not make it. So this is just to tell you that chest pain should be taken seriously and not to make assumptions until you see a doctor. So what test will tell you if it was a heart attack? Well, if you were to end up in hospital, the doctors might want to do an ECG, which looks for any abnormal heart rhythm rate or any evidence of damage to the heart muscles. They will also want to do blood tests, such as a troponin, which are enzymes that are released when there is damage to the heart muscle. A chest X-ray is usually performed, but this is normal if you're having heart-related chest pains, but this is to exclude other causes such as a chest infection or inflammation of the lungs. Or sometimes it might show that you've got an enlarged heart called cardiomegaly, which might trigger other investigations such as an echocardiogram to find out the cause of your enlarged heart. You'd also have a blood pressure check because in some cases, if you have heart-related chest pain, your blood pressure can be high at the same time. In short, don't rely on Dr. Google to diagnose your chest pain. You should always see your doctor for any form of chest pain. If you like this video, please click to watch my other videos and subscribe to my channel.